Welcome to Health Talk on Newstalk KGVO, AM 1290 and 101.5 FM with Peter Kristin and John King. Sponsored by Community Medical Center from day one.
All right, welcome everybody. Welcome back to Health Talk. I'm Peter Kristin. John King is over there. Dr. Anderson, you're back.
Thank you so much for having me. I love coming here and seeing you all.
Well, we love having you, and especially with the topic that you brought with us, because it is the 4th of July.
It is.
And so everybody's going to be out doing something with fireworks, right?
Well, that's what we wanted to talk about, how to do that safely. But, if you need the ER will be there for you.
Okay.
Is this something that pops up every year? Well, I mean, as a child playing with fireworks,
Good
we
word.
always heard legends of, the kid that lost fingers and things like that. Do you see every year at community people that come in with firework-related injuries?
Across the country, firework injuries are something that happen every year. We can almost predict it. So it's a good thing to talk about and bring some awareness. And, I always like to quiz you too, so I thought I'd bring some information.
Okay, here we go. I'm completely ignorant because, to be honest with you, fireworks scare the heck out of me. So, because as John knows,
that's a healthy fear.
John knows how nimble I am with my fingers and hands, especially with tools and other things. And something that explodes, I'm not really good about
It's not
that.
your
So
thing.
yeah,
Okay.
because when I was about 10. I had a couple of firecrackers explode in my hand.
Interesting.
While I was holding them, and they weren't powerful enough to really damage, the flesh.
Right.
But I couldn't feel my fingers for like 3 days.
Did you go to the ER?
No, my mom was a amateur nurse, and she said, "Stick it in cold water and wrap it, and
Deal with it.
you'll be fine."
Right.
Rub
Right,
some
right,
dirt
right.
on it, kid.
Yep.
I
I was
have
raised in that school too.
I have lit off fireworks in every wrong way possible in my short life.
Well, then you
So
can help us with the safety tips.
Yeah,
for
we
people.
could. I could tell you what not to do. First of all, don't if you are a hemophiliac, don't play with fireworks. Just
That's
probably
excellent
step
advice.
Step
and
away, let someone else light them.
I wouldn't have brought that up, so I'm glad you mentioned that. That's a good point. All right, it's quiz time for you folks.
All right, here we go.
Okay.
Now, don't try to call in, ladies and gentlemen. This is a pre-recorded program. So,
Right.
okay.
So quiz time. Can you guess how many thousands of emergency room visits go to the ER every year? Just an estimate. I have some information from 2014.
Are you talking all year or just on the 4th of July?
All year is what it says, because
Okay.
I suppose that you could release a firework any time of the year, I suppose.
So are we
Some
talking-
people do it on New Year's.
Oh,
So how
you
many
mean because of
firework
firework.
injuries? Yeah,
Got it.
firework injuries.
Okay.
Can you
all
guess?
year long. I would say 50,000.
That's a good guess.
I would say 100,000.
Oh, wow. Okay. So you're always the A+ guessers. The information that I have is actually an estimated 10,500. They see about 10,500 people.
Safer than
right?
I thought.
It's perfectly safe. Right. Activity. Great. You guys are a dangerous one to quiz.
I know, it's terrible.
Okay. So if you go, what's the percentage on different body parts? For example, how many people that go in, what percentage have damaged their eyes?
Oh.
I think it's going to be pretty high because if I'm going to go in, it's because a rocket hit me in the face.
There you
It's
go.
not because I burnt my finger.
Or you got the sparkler too close to your
Right.
eye, and you
Yeah.
get sparks
Right.
in your eyes and
Yep.
that sort of thing, right?
I would say probably 75% are because of face injury.
Well, I'm going to combine them. So eye is 19%, and head, face, or ear are also 19%. So you're in the 40s just
Okay.
with anything.
Okay, now
above
are
the
we
neck.
also talking about deafness because of a big boom?
That's a really good point. They don't specify that, but I would say ear, yes, would include that. And then hand and finger. Can you guess how many injuries go to the hand and the finger?
That's got to be the
Almost the
majority,
rest.
probably
Yeah.
60
Yeah.
to 70%.
Well, 36%, and then the rest are, 10% to the leg, 5% to the arm. So if you're going to hurt yourself, it's going to be above the neck or on your hand.
I'm just trying to imagine any unusual body parts that could be damaged with fireworks.
This is a
but
G-rated show.
This is why we don't have imagination broadcasting.
or somebody lights a sparkler and sticks it in your back pocket and forgets
There you
about it.
go.
Oh my
Yeah.
gosh, what happened?
Yeah.
So
Yeah.
anyway.
So, and then another question I have so what's the temperature you bake a cake, right? 350.
You're looking at a guy who
Oh,
has
wow.
not baked any
Okay,
cakes.
Okay. So what's the temperature that wood burns?
Hot.
Hot is right. 575.
575.
Glass melts at 900.
All right.
What's the temperature of a sparkler?
Isn't it
when
like
burns?
2,500 degrees?
Again, you guys are the A-plus guessers. You're
It's probably
always
only
way
like
it's-
600, 700.
Well, it's 1,200.
1,200,
But hot is right. So they're not, even the sparklers, they're
I would
not
lose on the
benign.
Price is Right every
You
time.
really
You're way over.
By A+, she means you've wrapped around to a D-.
I know. Okay, so the whole what you're trying to get across here is that even though these fireworks are especially used in the city, the fun ones like the poppers and
the novelty, I think,
and sparklers are included in that.
Absolutely.
Okay,
Absolutely.
so
But
now
they're
when
not benign.
when you have those things, you got to remember you can't just give them to the kids and go and sit aside and watch
No
TV,
way.
right?
Right. That's exactly right. So that brings us to, I brought in some firework safety tips, and we can go over that. And apparently you are an expert on that. So
So let's start with the one basic question.
Right.
And this is the question I've had to ask myself.
sure.
When do I let my child play with sparklers? Now, let's just go ahead and say I'm the kind of parent that will eventually, for sure, let my children play with
Right.
fireworks. Now, the question I have for you as a health professional is, when do you think is a safe time, a safe age to let a child play with, for example, a sparkler?
That's I can say I never got a handout or a board question on that in medical school. But I think common sense goes along with this completely. So if you feel like your child can follow instructions and understand the danger, I think that's a reasonable time. But if the child is too young to understand that this is a 1,200 degree piece of material,
We
in
don't
their
even
hand,
understand that.
I know.
We think it's like
right.
the
And so
sun
that's
or
the issue.
some.
Well, see, in my
And
view,
that's exactly the issue.
my answer would be if they're old enough for the draft, then they're
Right.
old enough to be able to handle.
Right, because you've been hurt. And
I'm guessing your daughter never got her ears pierced.
No, I'm
too,
sorry. Well,
right?
yes, she did, but they didn't do it with a sparkler.
but they could, because it's 1,200 degrees. Not that I'm advocating.
Okay, so do you? So basically, you're not saying any particular age.
There's probably no particular
It's up to the
age, but-
parent to be able to judge that.
Right, and I think fire safety tip number one is have a responsible person with some common sense that's doing this, and one that isn't using any alcohol. You need a designated firework person because you don't want your judgment to be to be impaired.
John is volunteering.
The
You need a
danger
designated
there.
firework person. Give me a call.
That's your
and of
guy.
course, if it were me, I would want a fireman in
Right.
full regalia standing behind me with a
exactly
hose that's pressurized, ready to douse the entire world.
I like your style. We've got the polar opposites.
we're on
here
different
in the room.
planes.
Soundproof, oxygen-proof chamber. Light it off. Watch the flash. Go home.
So
And
anyway,
I'm like, let's put it in a can and see if it lights on fire.
and
Oh,
that's
wow.
and that's
We
why
really-
and that's why nobody comes to my house for 4th of July
4th of
fireworks
July.
because it's boring, So
No, personal experience. One of the things people do that really injure themselves, and I mentioned the hemophiliac earlier.
Right.
That's a real story, people.
Oh.
Someone actually ended up having to go to the hospital for a firework related multiple times in my life. But one time was because of something people do. I mentioned a can a second ago, but people
Right.
put things in combination with
Absolutely.
fireworks, and it's really dangerous.
becomes an exploding missile.
That's right.
And you can do all kinds
That's
of stuff, but simply placing another object with the firework makes it perform in a way that could be dangerous. Shoot
wasn't designed to
shrapnel
do.
at you,
Yep.
could hurt you. And I think one of the things people do is they just don't follow the directions on the firework, right?
Absolutely. So you need to
You
follow.
mean
the
there are directions on the firework? I never got close enough to read them.
They are not your thing. And well, you might be able to speak to this, but also in this list that I have, it says if you purchase fireworks, you want to make sure that they're not ones for commercial use. They're for recreational use, and they can be wrapped in different things. So you want to make sure that you're buying something that's appropriate for what you're doing.
Okay.
You're not setting off a light show.
We're going to take a quick break here on Health Talk. Dr. Kristin Anderson joining us from the Missoula Community Medical Center. And this is Health Talk, and we'll be right back. And we are back on Health Talk. I'm Peter Christian. John King is joining us over there. Dr. Kristin Anderson. Now, you're a popular guest on this show.
Oh, thank
I
you.
mean, we've already done the gloop and the glop and the
slip slap.
Right, the
Right,
slip
that's right.
schlepping or whatever.
We've actually cashed in. We've got you your own amenity wagon with
Oh,
a star on the
finally,
front door and
finally,
everything.
Finally, the green
your
room.
own personal restroom, the whole bit. Yeah. Anyway, but right in the middle of talking about fireworks and fireworks safety. Now, John just brought up something very interesting before the break, and that was, especially boys. I don't know what it is about boys. They love to put, fireworks inside stuff and blow stuff up. Okay, that's what boys do.
That is.
Yeah, there's 1,000 anthills that have died to my hand.
That could be a crime in some places.
I'm sure it is. I'm just being frank with you. This is something we do.
It's an honesty show.
Yeah,
okay.
All right. And so let's talk about safety in that respect. I mean, fireworks, as you mentioned before, have warning labels and instructions.
Instructions and appropriate things to buy. I think since you brought that up about little boys like to do that, almost 3/4 of these injuries happen to males. So
Gee, I can't imagine why.
This is another example where, sorry, girls are smarter.
Just boys are bolder. There
it is. There it is. More risk.
She had it. I think about right.
So other things that, you want to do, which fits right into that, is you want to obey any laws. So, make sure that you're following the rules. If you're in the city, follow the laws for the city. Make sure that you're doing what you're supposed to do. Read the labels. Responsible adults should be around. Another one, how about, do you do this? Do you wear safety goggles when you light off your fireworks?
Ooh, I gotta say I don't.
Really a good idea.
Well, let's put it this way: in the male world,
sure.
Okay, when you're farting around with fireworks, okay, and you got a bunch of males together, the last thing one male wants to do is admit, I'm going to go get some protective goggles. What a wimp!
Yep.
You
Can
see
you
what I
put
mean?
on some sunglasses? Get some light. Do something though. But the injury to an eye isn't pretty.
Yeah.
And if you've seen an eye injury, it's not pleasant. It's not pleasant for anyone involved. It's not pleasant for those people standing around. It's pretty awful. And you only have two. And if you lose one, you lose your depth perception. So
Right.
your eyes are a pretty special thing. You don't want to mess around with
Now,
that for one night.
is it primarily with the rockets that hit you in the eye, or is it the explosive devices, or what?
Oh, I have some personal experience
I bet we
on
have
this
a personal story over here.
Okay,
John.
if you've ever been to the fireworks stand, you see those little missile barrages.
Right,
They're
yeah.
just little plastic missiles with some accelerant in there that shoots them up high. Right.
Right.
They go. They are my favorite thing to watch by far of all of the fireworks. But one 4th of July, we lit one off and we're sitting there watching, and then all of a sudden, boom, like a different magnitude. And we looked over and the car shifted over because one of those missiles hit the tire and exploded it.
Oh, wow.
Because it got wedged underneath the,
oh my God.
just perfectly.
The law of physics, yeah.
Yeah, so
Oh my goodness.
even those little things. I mean,
Right.
a child can go up and buy that sort of
Absolutely.
thing, right?
Yep.
And just something like that where there's erratic nature to it can be extremely dangerous.
Thank you for bringing that up. I mean, they're not benign at all, and the unintended consequences of even something as small as that can be catastrophic. What if you're parked on a hill? What if that rolls? I mean, we could do this, the what ifs all day, but be safe.
Okay, now there is, again, it's been a long time since I've done this, and there may be new technology involved.
Well,
here.
we have gunpowder now.
Thank you very much. Anyway, it's Confucius, but anyway, when I was buying fireworks, they had these little punks. You would light the punk, and you would use the punk to light the fireworks, right? Well, keeping the thing lit was just a joke. I mean, so you ended up just using a lighter on the firework itself. I mean, so let's just go right to the source and light it and run. So
sounds efficient.
Can you help us with that, Doctor?
I would say again, I would ask you to refer to the instructions, and I'm confident that would probably not be the safest way to go. Let's see if we can find some other ones. Oh, do you do this one firework at a time?
Well, it depends on the type.
Okay.
Let's be honest. Like you get those big chains of the fireworks, the loud ones.
Right.
You light those one at a time. There's like 500 to a pack. You're going to be there for a while. Hit them all.
And not only that, but when you have kids together and they want to have a contest to see which rocket goes the highest, and they're both on this concrete pad, and you light them together, but if one has a shorter fuse than the other, things could happen, right?
That's right. Things could happen. So the safest thing to do is, if you're going to do this one firework at a time, be careful.
Which is like
This is going to be hard.
This is changing your whole holiday. I'm never going to be invited back, am I?
This is hard.
Wow. So
How
what?
about this one? Now,
Go ahead.
this seems like a pretty obvious one to me, but you can tell me. Do not hold a firework item in your hand. Oh, okay. You want to tell us a story about that one?
Okay,
maybe?
John.
I mean,
Yeah.
I've done it.
I've done it too.
Really?
Yeah. One of my favorite things to do is to throw them in the water and watch them pop.
Okay.
Yeah.
Okay.
And then
well,
you see the big boosh. That's fun. But you can't do it unless you throw it, or you buy waterproof fireworks, which are expensive. This is really stupid, and I would never let my child do it. But yeah, I've done it.
Okay, we're going to take our last break here. We'll come right back and continue talking about how to kill your fun for the 4th. I'm just kidding. We're talking about safety on the 4th of July. We'll be right back on Health Talk. And we are back on Health Talk, and Dr. Kristin Anderson joining us. Okay, we have like 3 minutes of very valuable time here for you to share with us, the best ways to stay safe on the 4th of July.
Well, yeah, and we've talked about a few of them. I'm going to run through a few more. I think you've already brought one up. Use fireworks, I can't believe I have to say this, but outdoors, away from buildings and cars.
There's an idea.
Yeah, there you go. Don't relight a dud. If you have a dud, don't relight it. Wait 20 minutes and soak it in some water before you get rid of it.
Okay.
Okay. Store them in a cool, dry place. Have a water hose, something available, because if things do get out of control, you want something there to help you.
Or a fire extinguisher if you got it.
Absolutely.
Especially if you're going camping or whatever. Yeah.
Yep. Don't carry fireworks in your pocket. Shoot them into metal or glass containers. That just seems like another obvious one, but again, apparently something I need to say out loud. Don't experiment with them. Dispose of them safely. Wet them down. Put them in a metal trash can. And then a couple things I do want to bring up that I think, are bigger picture items. This can be terrifying for pets. So think about your pets, and if this is something that they don't need to be a part of or inside, or even so, those loud noises are terrifying. They don't understand them. And then another final thing, and I've had some patients that have talked to me about this, our veterans, this can be a really tough
PTSD,
day.
right?
Absolutely. This can be a really tough day. So a day that they just want to get over. So you might want to think about that and be, aware of that, cognizant of that, and respectful. Maybe if your neighbor has that, maybe that's not appropriate for you to be playing around.
So really, preparation is important. Adult supervision is important. And having the right equipment on hand is important, right?
That's right. And important to have your ER right down the street if you need it.
We have a direct pipeline to the ER here. Okay, so how can folks get in touch with you to find out more about all this wonderful stuff?
It's communitymed.org. Be aware that there are doctors and nurses and the whole staff ready to help you if it happens, but we sure hope it doesn't happen and that you have a wonderful 4th.
All right, let's all be safe out there, okay?
That's right.
John.
Don't be like me.
Be like cautious Peter, okay?
That's right.
Who sits under the bed the whole day. No, thanks for joining us here on Health Talk. That is going to do it here on KGVO. Have a happy and safe 4th of July.